Okay, guys, we are back. My hair's as crazy as ever, and we're gonna go into this slow, but we are going to get back into this. For those of you who may be new, I am reading this. I am reading the Mandate for Leadership Project 2025. I am reading this out loud. I started reading this out loud back in July when I bought this. This is one of two manuals. This is the second manual. We're still on the first manual. And I was reading it daily and daily and daily. And I stopped because I didn't think we'd be here, but here we are again. So if you're coming into my live, you're more than welcome to stay. But because of all the drama and all the weird DMs and all the MAGA bullshit, it's sub only for comments so that I can weed out anybody else's comments that I don't want to have to look at in case there's something that somebody needs an answer to. So if you followed along, we got through all the way to chapter 12, and I'm going to go back and show you guys kind of where we started, where we are, and I'm going to skip ahead a little bit because I'm going to read one section before the next. So this is a 922 page document. Like I said, I've read all of that so far, and if you miss any of it, if you go to the link in my bio, you can see my YouTube, and it goes page for page for page for page, and that's how we do it. So here are the topics that are in this manifesto, as it were. We've talked about Section 1, taking the reins of the government. Section 2, the common defense. Section 3, the general welfare. Section 4, the economy. Section 5, independent regulatory agencies. And that's where we are as far as that. Now, we've gotten through, we did all of Section 1, taking the reins of the government. And we did Section 2, the common defense. We got all the way through to, we did Department of Agriculture, Department of Education. I think what I might do is, first and foremost, I'm going to skip ahead from chapter 12, because 12 is Department of Energy and Related Commissions, 13 is Environmental Protection Agency, but 14 is where you're going to see the Health and Human Services, and these are things that are going to be impacted. So I'm going to read chapter 14, not to be confused. So, and I will, oh, thanks for joining the team, guys, and I appreciate it. Again, like, follow, comment, share. If you want to subscribe to have comments, that's fine. I don't always see them, but I do the sub-only comments just to weed out all the noise. So again, you can follow this in my YouTube if you want to go all the way back, because we got through the preface all the way to 368, I think it was. But this, I'm going to skip those two chapters, 12 and 13, because I want to read 14 today so that you kind of understand what's coming. Okay? So Chapter 14 is Department of Health and Human Services. I'm just seeing, and right now, guys, only because I'm reading, I probably won't have anybody come live with me just because I want to get this portion out, but there will be some things that we can do for subs and whatnot later on. So, Department of Health and Human Services. If the Department of Health and Human Services were a separate country, its approximately 1.6 trillion budget would rank as the world's fifth national budget. Let me see if I can turn that up a little better. I bet we can hear a little better now. For good or ill, HHS activities personally impact the lives of more Americans than do of those any other federal agency. Now, this is the agency that he wants to give to RFK Jr. So, these are the things that should concern you. Okay? Under President Trump, HHS was dedicated to serving all Americans from conception to natural death. And that is a big point to make, from birth to natural death. So when they say things like natural death, they're taking out things like schmabortions. They're taking out things like euthanasia. They're taking out things basically from birth to natural death, including those individuals and families who face economic and social well-being challenges. Under President Biden, the mission had shifted to promoting equity in everything we do for the sake of populations sharing a particular characteristic, including race, sexuality, gender identification, ethnicity, and a host of other categories, which they don't deem as human. So just so you're aware. As a result of HHS's having lost its way, U.S. life expectancy, instead of returning to normal after the COVID-19 pandemic, continued to drop precipitously to levels not seen since 1996, with white populations, key word guys, page 449 if you're following along, white populations losing 7% of expected lifespan in just 1 year. They're not talking about women. They're not talking about anybody who's African American, Latino, Asian. No, they're talking about white. They are concerned that after COVID-19, 7% of white people, clear skin like me, dropped off. Nothing less than Americans' long-term survival is at stake. According to HHS, must return to serving the health and well-being of all Americans at all stages of life instead of using social engineering that leaves us sicker, poorer, and more divided. I don't know about you, but with all of these plans in place, everything is a projection. It really should be called, like I've said, Projection 2025, because that's exactly what it is. They're projecting. Okay, everybody take a drink. Overview. HHS consists of 11 operating divisions that have varying degrees of practical independence from Secretary of Health and Human Services, and 15 staff divisions that are directly under the office of the Secretary. This chapter recommendations are limited to those divisions that most need reform and address whenever possible 5 cost-cutting goals. So they're already, page 1, white people are somehow less, there's less white people after COVID-19, and we're going to talk about how we can cut measures to help the sick and the poor when cutting cost measures is going to hurt the sick and the poor. You see what I mean? It's like, okay. Oh, thanks for joining the team, Don. I appreciate you. Okay, so goal number 1. And again, guys, if you're following along, it's page 450 on Project 2025. Thank you guys for the gifts. I appreciate you joining my team. If I don't see your gift or I don't see you join my team right away, I apologize. I am just reading, but it is appreciated because it lets me do the work that I do. Back to it. Goal number 1, protecting life, conscience, and bodily integrity. Thanks for joining the team, guys. Thanks, Lolo. Thanks, Kelly, for joining the team. The Secretary should pursue a robust agenda to protect the fundamental right to life, protect conscious rights, and uphold bodily integrity rooted in biological realities, not ideology. So, what they're saying is, white man, white woman, white babies. Other people, LGBTQ, you don't exist, per se. Thank you, San Juan. I appreciate you. Again, guys, if I see it, I will say it. If I don't see it or it flies by my, I apologize, but I appreciate all the effort that you guys are doing because I know this is important. This is what we're going to be facing. In 72 days, 71 days, this is going to be a reality. So I have the handbook that's going to be the reality. So a lot of people, this is a lot to digest at one time. Thank you, Rebecca, for the lightning. This is a lot to digest. So that's why I said I will go over, and you can go to YouTube and you can upload. This is, again, going to be a little out of order simply because I want to get the main points addressed as early as possible. Sorry, I was just reading the bottom of kids said something about says, see real-time U.S. election results. I know them already. Thank you, TikTok, for reminding me. Remember, guys, if you're coming here, just make sure to like, share, follow. If you subscribe, you can comment. If not, it's okay. I just try to weed out a lot of the noise that comes in because sometimes it's literally just Trump 2024 all the way down. And it's like, okay, he won, cool. Now what? Now let me tell you what you're about to be in for. Okay. From the moment of conception, remember, this is the moment of, this is what they're saying. This is Judeo-Christian values right into this. From the moment of conception, every human being possesses inherent dignity and worth, and our humanity does not depend on our age, stage of development, race, or abilities. Yet they want to take away the ability to live as you are because they think it's an ideology. Thank you, Martha, for the rose. I appreciate you. Thank you, Nan, for the glasses. I appreciate you. The Secretary must ensure that all HHS programs and activities are rooted in deep respect for innocent human life from day one until natural death. Abortion and euthanasia are not healthcare. You will see me take this out several times, guys, because I read this, but I do try to go back and highlight some points that are big. So remember, guys, conception until natural death, because abortion and euthanasia, they're going to be gone. Thank you for the heart user 818435. A robust respect for the sacred rights of conscience, both of the HHS and among governments and institutions funded by it, increases choices for patients and program beneficiaries and further pluralism and tolerance. The Secretary must protect American civil rights by ensuring that HHS programs and activities follow the letter and spirit of religious freedom and conscience protection laws. When they talk about religious freedom, they are talking about Christianity. They are not talking about Hindu. They are not talking about Muslim. They are not talking about atheist. They are not talking about agnostic, Wiccan, nothing. They're talking about Judeo-Christian. That's what this refers to. This whole document, when they talk about religion, that's what they're referring to, is only Christian. Just so you know. Radical actors inside and outside government are promoting harmful identity politics that replaces biological sex with subjective notions of gender identity and bases a person's worth on his or her race, sex, or other identities. It's not about oh, thank you for the star. I appreciate you, Rebecca. It's not about promoting the identity, and it says promoting harmful identity. No, it's who they are. Thanks for joining the team, and I appreciate you. It's who somebody is. And they're saying, oh, but that's not what their Bible says. Okay, so far for a caveat. I'm a Christian. I was not raised that way. I went to church. I found friends. I did all of that goody stuff. And then after a while, I went, oh, thank you for joining the team, Jenna. I appreciate you. But they're just talking about how this is the only way, when that's not the case. And this is nothing Jesus would have done. Thank you for the heart, and I appreciate you. This is coming in hard with the hearts, and I appreciate you all the time, guys. Thank you so much. It goes back to because they say the Bible says that, when in reality, the Bible says nothing of that. He's going to peddle more Trump Bibles because of this, because it's going to have the Constitution, well, the Bill of Rights, but not the full ones, only 1 through 10. So, the destructive dogma under the guise of equity threatens America's fundamental liberties as well as health and well-being of children and adults alike. Oh, thank you for the, sorry, here my eyes. Thank you for the lightning, Todd. I appreciate you. The next secretary must ensure that HHS programs protect children's minds and bodies, and that HHS programs respect parents' basic right to direct the upbringing, education, and care of children. That is, thank you for the crown, High Hopes. That is going to be a very important thing in this chapter. You're going to see where it is husband, wife, child. Husband, work, wife, traditional, stay home, do everything. role. This is exactly what this refers to. Number 2, goal, empowering patient choices and provider autonomy. And just so people are aware, because I have seen this across many platforms and it has bothered the hell out of me. People are like, yeah, he's just going to get rid of Obamacare, but I still have the Affordable Care Act. Sir, that is the same fucking thing. Mind you, the Affordable Care Act is only the reason that J.D. Vance's mom has insurance. Remember that. The fucking new vice president, upcoming's mother, could not get health insurance. She had to go through ACA because that's how she could get it to pay for it. Think about that for a minute, guys. And he wants to repeal Obamacare. Repealing Obamacare repeals the ACA. I'm sorry. My hair is getting in my face a little too much. So anytime somebody says, yeah, well, he's going to do the ACA. No, he's not going to do the ACA. He's not going to do the ACA. ACA is Obamacare. So just like a lot of things people are referring to, like people Googling, like, what's a tariff? Why did you not Google that before you voted for him? Like, I don't understand. Where were we? I apologize. Goal number 2. Basic economic holds that tend to cost, trend, increase, quality, and options tend to increase where there's a robust and free competition in the provision of goods and services. Healthcare is no exception. Healthcare reform should be patient-centered and market-based and should empower individuals to control their healthcare related to dollars and decisions. And right now, tomorrow, Mitch McConnell is calling for a secret vote, and one of those people, either John Cornyn, John Thune, or Rick Scott, is going to now be the majority because Mitch is out. And I'm going to tell you right now, if it's Rick fucking Scott, you're going to be in a world of fucking trouble. You are going to be in a world of fucking pain because that man worked for insurance companies before he got into politics and paid billions for fraud. So they're trying to go to market insurance, but it will be one insurance that you will pay through the roof for. And it's not going to be anything that you've had before. Watch. Medicare Advantage Plan. Look that up. That's exactly what they want. They want you to work as long as possible. They want you to work until you're almost dead. And then when you're going to reap benefits, maybe no, you're not. You know what I mean? Okay, guys, hang on a second. It's telling me something. I am not very... Oh, thank you for the crane on D. I appreciate that. It's telling me to reset my goal. Again, guys, I'm not very familiar with gifts on this, so I do appreciate that you guys have been doing that. But it's telling me to go... Look at this one. She's so pretty. And we need the feather, and I appreciate you. Again, guys, I love gifts. They're great, but they're not... You don't have to give gifts. I appreciate them. It allows me to do the work I do. But it is not, there's nothing you guys have to do for that. But it's telling me to reset my goal. Okay, set up a new goal. So I apologize for the interruption in this, but let's do, I don't know what they want me to do. So I think you just like select one. But these are all, that is entirely too expensive. What is wrong with you? Okay, I'll set that one. I'll do that one. We'll do... See, this is where it's going to make me crazy. Live. Sure, I guess. Confirm. Goal. Goalie. Sorry, guys. I'm not... It just tells you to reset the... And I'm so not familiar with that because I just like to read like what I do. Okay. So, of course, providers who deliver health care also need freedoms and address the unique needs of their patients. States should be the primary regulators of medical profession, and the federal government should not restrict providers' ability to discharge their responsibilities or limit their ability to innovate through government pricing controls or irrational Medicare and Medicaid reimbursements. Irrational. If you've ever known somebody who's been on Medicaid or Medicare, the fact that they would be like irrational schemes. These are the poorest of the poor, the most indigent kids who are disabled, sick, elderly adults, disabled. Like, you're trying to say that they're scheming. Bitch, they just want insurance so they don't fucking die. Like, I don't get what you don't understand. But okay. irrational. Finally, America's broken insurance system, run largely through confusing provider networks and third-party payers, employers, introduces overconsumption of healthcare, limits consumer shopping, and hides true costs from patients. Overconsumption of fucking healthcare. How dare you be sick and need higher care? How dare you need a surgery? How dare you need additional medical care? How fucking dare you? How dumb does that shit sound? You're right. I should just pray it the fuck away, right? That's what I should be doing. Just praying it away because irrational. What's the word I used again? On page 450, overconsumption. I am taking too much of advantage of healthcare so that it doesn't become fucking death care. I mean, seriously? What the fuck is wrong with you? No, you don't need both eyes. One cataract surgery is enough. You had a liver transplant. Just walk it off. Overconsumption. I personally know people who have not gone to the doctor because they're like, no, it's going to cost too much. So this bullshit of overconsumption of healthcare, fuck you. That's why I have a deductible. Fuck you. That's why I pay for it with my employer. Fuck all around. That's what happens. Overconsumption. How dare you get healthy? How dare you? Woo, thank you, Lisa, for the live on air. I appreciate you. Again, guys, I set these goals because they tell me to set these goals. And it's like a big thing. I think it's like reset. And I'm like, okay, but can I just read? Okay. Apparently it wants me to interact. Thanks, Triple, for joining the team. So remember, guys, don't have overconsumption of healthcare. How dare you? Lauren with the computers. Hi, Hopes. Welcome to the team. Sorry, guys. I get very scatterbrained very fast. So if I'm like, ooh, shiny, it's okay for you to comment if you're a sub that you're like, hey, you're not on task. I'm like, but it's shiny. It's pretty. Okay. Woo. Take a drink. Reset. Make sure you're hydrating, guys. Make sure you are hydrating. The federal government should focus on reform on reducing burdens of regulatory compliance, unleashing innovations in healthcare delivery, ceasing interference on daily lives of patients and providers. Oh, that's fucking rich. Ceasing interference, but abortion is healthcare. No, it's not. That's an interference, but it's your medical. Nope, but not that interference. Jesus Christ. Returning the control of healthcare dollars to patients making decisions with their providers about their healthcare treatments and services. I thought you just said you didn't want overconsumption. I thought you said you wanted to overhaul it. Exile in Texas for the live on air. Thank you. Maybe that's what I'll do. I'll just set like some stupid, ridiculous ones. Kind of like whatever. Because I don't want you, this is... It's making us all crazy, and if I can make us a little less crazy, but in a good way, good crazy, like there's good trouble, I'm going to be good crazy, because you can clearly say, Nan with the live on air. Look at you guys. Ooh, ooh. Knowledge. I know, we're going to take forever to get through this, but we're going to get through it. I already did the first 12 chapters. Or up to the 12th chapter, and I'm reading the 14th, but we're going to get there. We're going to get there because this is going to impact all of you. And again, if you miss this, if you can't listen to me ramble forever, trust me, I get it. But it will be over on my YouTube. I will upload it later tonight after I'm done with my live. The only caveat that ever comes with if I'm doing a live, and somehow something happens and it gets reported, it takes my live away. So then I have to redo it. So I try to be as conscious as I can, but unfortunately I'm fucking human. And right now we're in a fucking shit storm. Maria coming in with the live with a phone on air. Thank you, Hope with the roses. I appreciate you guys. Of course. Now we can go on to page 451 with the computer. Thank you. Okay, so goal number 3. Promoting stable and flourishing married families. Okay, this is the part you're going to want to buckle up for, because when they say married families, they mean father, mother, many children. That's what they refer to. That's what that means. So when they're saying the goal, number 3, for Health and Human Services that RFK is going to head up is promoting stable and flourishing married families. A man who's been divorced twice. I mean, but whatever, cool, right? Families comprise of married mother, father, and their children are the foundation of well-ordered nation and a healthy society. So, if you are a lesbian and you have children, you don't count. If you're a single mother, you don't have a count. If you're a single dad, you don't have a count. If you're a single grandparent raising a child and you're disabled, you don't count. They don't give a shit. They are talking about a wife, a husband, and all the children to repopulate a workforce. That's what they're referring to. President Biden's HHS is fraught with agenda items focusing on LGBTQ equity, subsidizing single motherhood, disincentivizing work, and penalizing marriage. These policies should be repealed and replaced by policies that support the formation of stable, married, nuclear families. Do you see what they're saying? So, let's say you're married and your husband pow, smacks the shit out of you, right? So you leave, right? So you leave, you're a single mom and you're out. They don't think that is as important as you staying in the marriage. I said what I said and you're gonna see it because they want to get rid of no-fault divorces. This is gonna be a long 4 years, guys, and we're gonna get there together, but we're gonna go line for fucking line. Working fathers, not mothers, working fathers are essential to the well-being and development of their children. So even if you're husband and wife and decide to have no children, they don't think you're worth shit anyway. Working fathers are essential to the well-being and development of their children. But the United States is experiencing a crisis of fatherlessness that is ruining our children's futures. Maybe daddy shouldn't have been a fucking asshole and cheated on mom. Maybe dad shouldn't have beat the shit out of mom. Maybe mom got pregnant and dude left, so there was no father anyway. Like, you're penalizing women. Thanks for joining the team, Fizz. That's what they're referring to. So they're basically saying, as long as you're married and you stay married, you're great. And if you leave, nobody wants to disincentivize work. Nobody wants to penalize marriage. But you penalize, Now I need some actual caffeine. Okay. In the overwhelming number of cases, fathers insulate children from physical and sexual abuse. On with the live on the air. Thank you. I appreciate you. In the overwhelming number of cases, fathers insulate children from physical and sexual abuse, financial difficulty, or poverty, incarceration, teen pregnancy, poor educational outcomes, high school failure, and a host of behavioral and psychological problems. They're saying that only the father can insulate those. Thank you for the live on air. I appreciate you. They are saying that. That is what they're saying. Not a mother who holds down 2 jobs, who works her ass off, right? Not 2 gay men who have 4 children. Not you guys. We're talking about just fucking straight fathers. They're the ones who insulate from all of the bullshit that you go through, which is just, it's asinine. It's asinine. By contrast, homes with all non-related boyfriends present are among the most dangerous places for a child to be. HHS should prioritize married father engagements in its messaging, health, and welfare policies. What if you want to have kids and never have a husband? What if you've been divorced? What if you never want kids? What if you just want to be married and not have kids? Thanks for joining the team, Hospice. I appreciate you. You see how it's like, putting it all back. See, this is why all these white fucking MAGA chuds are like, yeah, fucking Trump won. Because they get everything again. There is not one white man who has had a hardship in any of this documentation. Not one. It is very much against women. It is very much against women of color. It is very much against immigrants. It is very much against anybody. Oh, thank you for joining the team, Amy. anybody who is anything different than white Christian male. And they can say, that's not Trump's agenda. Yes, the fuck it is. Just look at who he's already putting in his cabinet. They're putting people in the cabinet that were authors for this, okay? So no denying it anymore. Oh, joke's on you. We really are doing it. No fucking shit. We fucking told you. It's like, besides, can I change my vote? What is Project 2025? And what is a tariff? Those are the top 3 Google searches. Why were you not looking at this before the fucking election? Half of you out there who voted, like, I don't like any candidate. Well, pick someone, because now you've just picked this fucker to go back to the White House. And if you think like in 3 seconds, JD's not going to be like 25, 25, 25, hit that 25 button, and he's going to, because JD is a product of Peter Thiel. Who's Peter Thiel? PayPal. Who is also Peter Thiel with? Musk. Like, do you see? Do you see? Do you see what's happening? A gay man and an illegal immigrant are taking over the U.S. Constitution. Who'd have thunk? Who'd have thunk money would be the end-all, be-all for everything? Everything. Thanks for joining the team, Jen. In context of current and emerging reproductive technologies, HHS policies should never place the desires of adults over the right of children to be raised with biological fathers and mothers who conceive them. So, let's say you have a kid and you're with your spouse, your boyfriend, whoever, and you're like, I can't care for this kid. So you then put that child up for adoption because you yourself were an addict and you yourself were crazy and all over the map. They are saying that children coming back to you, because you were biological, is better than the nurturers who adopted you. Think about that for a minute. How does this even make sense? Yes, we understand that you're both crack addicts and that you smoke meth all day, but you are the biological parent, and according to our statistics, you are better for that child than a mother who has waited to have a baby forever and adopted one after 10 years with a husband in a good home. Because you're not biological, you're less than. Wow. Wow, page 451. It's right there. Thanks for joining the team, Kelsey. Whew. In cases involving biological parents who are found to be fit or unfit because of court, the process of adoption should be speedy. It should be speedy, certain, and supported generously by HHS. But they're also about reunification. So is it speedy under your terms or speedy just because what? Like, why does it need to be speedy? Why have we not always had it be speedy? They're children. Okay, on to goal number 4. Preparing for the next health emergency. Oh, okay. This is going to crack me the fuck up because the next health emergency, so COVID-19, who was president? Donnie. Did he do a great job? Did you drink bleach? Nope. No, you did not. Did you, I don't know, have light inside? Did you take horse paste? Obama went, here, in case something fucking happens, here's the manual. And he went, fuck that shit. And guess who got COVID? And guess who got the best treatment at Walter Reed? And then sold off all of our testing supplies and gave the fucking ventilators to Russia. And then we're like, oh, why are we dying at higher rates? Oh, I don't know, because our president is giving everything away. So, but let's prepare. Uh-oh. Hang on a second, guys. It's telling me live restricted for some audiences. I am not, let me see. I am not eligible for recommendations and restricted in search because my live does not comply with the for you. Oh, it's saying because I said what happens to families, it's not going to allow. It said that I spoke of ruggies. Nom, nom, nom. Because I said ruggies. It's not going to let it appear on my For You feed. That's fine. Again, this happens to me all the time. I will talk and I will say words that are normal words for people to say. And because I said it in a context in which it actually applied, This is what happens. This is why I have my subscriptions. This is why the comments are turned off unless you're a subscriber, because shit like this always happens. It happens all the time. Do not worry. If I get banned, I'll be back. If they suspend me, I'll be back. It's okay. Look at you used for the first time. Thank you for joining the team. Again, guys, I'm just trying to read things that are coming along here. So yeah, it's not going to push my content. If you want to like, follow, share, I know you can't comment unless you subscribe. If you want to like, follow, share, that's totally fine. I apologize that I use the word DRUGS. Thanks for joining the team. Is it Mio? I'm never going to get names right, guys. Don't worry about that. But they'll try to do that. They try to do that all the time. Because facts are hard and it'll pick up like one little thing and they just won't like it. So we will talk less on the rugs, okay? I'll have to use context clues when speaking to adults on actual words from a mandate. But we'll try. The COVID-19 pandemic demonstrated how catastrophic, micromanaging, misinformed, centralized, and politicized federal government can be. Basic human rights, medical choice, and doctor-patient relationships were trampled without scientific justification and for extended periods of times. Excessive deaths not due to COVID-19 skyrocketed because of forced lockdowns, isolation, vaccine-related mass firings, and colossal disruptions from the economy and daily rhythms of life. This is true. Oh, it says 2 restrictions. Let me see. I just have to take a screenshot. 1 second, guys. Thank you. Okay. The federal government's public health apparatus has lost its public's trust. The one thing you need to keep remembering when they're talking about COVID-19 and people being treated unfair and having to wear a mask and having to get vaccinated and having to, have space, and because the world did. This was not a United States unique pandemic, okay? This was worldwide, and we led the shit charge. We were the ones with the most deaths and the most cases, and they're saying it was politicized. No, everybody around the world was wearing masks, they were distancing, and they came to be better knowledgeable and more understanding, because our leadership was like, yeah, how dare you infringe upon my face? If any of you have ever been to a dentist, a doctor, a surgeon, anyone, if any of you have ever been there, they have masked up. If you have gone into a situation where you are doing construction in drywall, you will mask up. It is to protect you. But they're saying we infringed. Bitch, this is not 2A. This is sound medical science telling you to decrease the transmission, you had to wear a mask. And it was pretty fucking inconvenient, and we all hated it. But you know what? We did it because there are people on this side that I care about that cannot wear. My child cannot wear a mask. He cannot wear a mask. He could never. He has never. He cannot tolerate it. Okay? My child has rare disorder and he has special needs. So 100% did I get vaccinated. 100% did I use masks. 100% did we isolate, because I did it to make sure that my child would be okay, because I knew if he got sick, it was going to be a race to get to the ER, and you'd have to be isolated. Now, granted, my husband and my son both got COVID at the same time, and for 6 days, I just rocked back and forth. It was me triaging both, back and forth, back and forth. Caveat here, have never had COVID. Just so you are aware, never once. I have never tested positive once. I have felt crappy a couple of times. I have never once had COVID. And I have had all 3 vaccines. I'm getting my 4th booster next week. So you can imagine when people talk about medical science and then saying you are infringing because I made you wear a fucking mask, man up. It's ridiculous that was even a thing. You were doing it to protect yourself and other people because nobody knew what this was going to do. Nobody understood. And we were learning together. And as we were getting facts and as we were getting information, you have our Health and Human Services writing this part of the manual saying, thou shalt not infringe upon my face? Wow. Okay. The federal government's public health apparatus lost its trust. Before the next national public health emergency, this apparatus must be fundamentally restructured to ensure transparent, scientifically grounded, and more nimble, efficient, transparent, unique needs for the input of patients, populations, and providers. We gave you scientific facts. We gave you scientific reasoning. As we were learning it, we did that. And you still didn't listen. Like, what are we going to prepare for? And if, God forbid, we have another pandemic in the next 4 years, bitch, I'm locking my door. We're going to stay inside. Nope. I will stock up and stay the hell inside because I don't trust anybody, MAGA, to do anything again. It's going to be like, if sometimes I think about, well, if there's another pandemic, it's just going to take care of itself because we didn't learn the first time. Every one of the overreaching policies during the pandemic, from lockdowns to school closures to mask and vaccine mandates and passports, received its supposed legal justification from the state of emergency declared and renewed by the HHS secretary. Telling, however, the threshold for what constitutes as a public health emergency, how many cases, hospitalizations, death, etc., was never defined. For the sake of democratic accountability, we must know with clarity what will trigger the next emergency declaration and, just important, what will trigger its end. Not having the current administration that's about to come up. That's what I would prefer. Because had it been Hillary, it would have been different. Had it been Joe, it would have been different. We had Donnie, and guess who we're getting again? Yay! Oh, thank you for that. I appreciate that, world peace. So, we are on page 452. I'm sorry, my nose itches like crazy. Ugh, probably because of my hair. Unaccountable bureaucrats. By the way, they talk about Anthony Fauci like he's garbage in here, which blows my mind. Unaccountable bureaucrats like Anthony Fauci should never again have such a broad, unchecked power to health issue guidelines that will certainly be the basis for federal and state mandates. Never again. Hang on, do I have a bat in the cave? Sorry, my nose is itchy. Never again should public health bureaucrats be allowed to hide information, ignore information, or mislead the public concerning the efficacy or dangers associated with any recommended health interventions because they believe it may lead to hesitancy on part of the public. The only way to restore public trust in HHS as an institution capable of acting responsibly during a health emergency is through the best of disinfectants. Light. You guys, look at this. Live on air. Thank you for that. I appreciate you, Blue Eyed Girl. Look at that right there. I probably can't see it well. It says, the only way to restore public here, I'll highlight it. The only way to restore public trust in HHS is an institution capable of acting responsibly during a health emergency is through the best disinfectant. Light. Light. Holy shit. Goal number 5. Instituting greater transparency, accountability, and oversight. The next administration should guard against the regulatory capture of our public health agencies by pharmaceutical companies, insurers, hospital conglomerates, and related economic interests that these agencies are meant to regulate. And everybody Trump is trying to put in place has benefited greatly from pharmaceuticals. So just remember that. We must erect robust firewalls to mitigate these obvious financial conflicts of interest. All National Institute of Health, Center for Disease Control and Prevention, and Food and Drug Administration regulators should be entirely free from private biopharmaceutical funding. Why am I reading that wrong? Biopharmaceutical. I'm like, why am I? Should be free from all biopharmaceutical funding. In this realm, Public-private partnership is a euphemism for agency capture, a thin veneer for corporatism, and funding for agencies and individual government research must come directly from the government with robust congressional oversight. The National Institute of Health, the Centers for Disease Control Prevention, and the FDA are all going to be headed by RFK, a man who said vaccines cause autism, a man who wants to take fluoride out of the water day one. I don't know about you, but I'm about to go buy those big blue, like, drum barrels, and I'm just going to sit somewhere and be like, yep, I'm filling up these because they're in the drinking water. They're going to have fluoride, and people are going to want that because bye-bye to your fucking teeth. All of you bitch about my teeth all the time. Yeah, they're discolored. I'm older. I've had medications. I've had health issues. I do what I can, but it's going to take it out. It's going to make it worse. I'm just going to let you know. Whoo, Lordy in heaven. We must shut it and lock the revolving door between government and big pharma. Then why would you be promoting Rick Scott? Remember, projection 2025. It's not project 2025. It is projection 2025. Shut the door. Regulators should have a long cooling off period on their contracts. 15 years would not be too long. That prevents them from working for companies they have regulated. And again, Rick fucking Scott. Similarly, pharmaceutical companies' executives should be restricted from moving from industry into positions within regulatory agencies. Rick Scott. Finally, HHS should adopt metrics across the agency that can objectively determine the extent to which the policy metrics across the agency and programs achieve desired health and welfare outcomes is, not agency outputs. What is not measured is not achieved. Centers for Disease Control and Prevention. So this is the CDC now. COVID and structural reforms. COVID-19 exposed the Center of Disease Control and Prevention as perhaps the most incompetent and arrogant agency in the federal government. Yeah, the CDC. CDC continued misjudged COVID-19 from its lethality, transmissibility, and the origins of treatment. We were told masks were not needed, then they were mandatory. CDC botched the development of COVID tests when they were needed most. Oh, okay, we were told masks weren't needed, then they were, because we found out the science was backing it. CDC botched the development of COVID tests because Trump gave them to Russia. When it was too late, we were told to put our lives on hold for 2 weeks to flatten the curve, and that in 2 years of interference and restrictions of the smallest detail of our lives, Congress should ensure that the CDC's legal authorities are clearly defined and limited to prevent a reoccurrence of any such arbitrary and facilitating exercises of power. We knew what was happening as it was happening, and we adjusted accordingly. Halo, thanks for joining the team, love, I love you. So we knew what was happening in real time, and then we would adjust. That's how no masks, stay in line, vaccines, distance, as we knew. But to say that we were not getting the proper testing, that's because of who you just elected. He gave it to other countries. Russia. Gave it to Russia. When y'all were waiting for tests, he gave it to Russia. Ventilators, Russia. So everything is a projection. It's always a projection. The CDC should be split into two separate entities housing its two distinct functions. On one hand, the CDC is now responsible for collecting, synthesizing, and publishing epidemiological data from individual states, a scientific data gathering function. This information is crucial for medical public health researchers around the country. On the other hand, the CDC is also responsible for making public health recommendations and policies, inescapably political function. At times, these two functions are in tension or in clear conflict. In February of 2022, for example, it was reported that 2 full years into the pandemic, the agency leading the country's response to the public health emergency has published only a tiny fraction of the data it collected, much of which could have helped state and local health officials better target in their efforts to bring the virus under control. A CDC spokesman said one of the reasons was fear that the information might be misinterpreted. That is exactly why. So they're saying, oh, we're not getting the information we need because every time we told you what we fucking needed, you pushed back. Every time we told you when we found something, thank you, Blue Eyed Girl, for the live on there. Oh, now it's telling me goal achieved again. Let me make this point and then I'll recalculate that so it stops going on my feed. Oh, thank you for that. I appreciate you. Oh my goodness. So yeah, them saying that it should be split is wrong. They're blaming the CDC. Thank you for joining the team, Nancy. They're blaming the CDC for the CDC is like, we have to back off because every time we tell you something, you say no, and then you go tell them to eat horse paste or inject light. You literally said light. And so they're like, no, we can't give you the data because it'll be misinterpreted. And every time they did it, it was, I'm going to threaten Fauci. Every single time they're like, I'm not going to cause more public health scares and public outreach when y'all, thank you, Hospice, for the live on air. Okay, that's right, guys. It's telling me to reset my thing again. Sorry. I am so sorry. I will let me highlight where we were. Okay, let's see. Now what does it tell me to do? Okay, set up a new goal. Okay, I guess set up a new goal. I love to talk, but I am so bad at this. These are all, what is, I'm sorry, I'm just looking at things like a TikTok universe. Girl, is that a dollar amount? What are we, let's just try something. I'll do cap. I'll just do cap. Because I've seen it before, I guess. I don't know. Confirm. No. Okay. So that'll be out of the way. The distinct functions should be separated into two entirely separate agencies with a firewall between them. Okay? We need a national epidemiological agency responsible for only publishing the data and required by law to publish all of the data gathered from states and sources. A separate agency should be responsible for the public health with a severely confined ability to policy recommendations. The CDC can and should make assessments to the health costs and benefit of all health interventions, but it has limited to no capacity to measure of social costs or benefits that they may entail. For example, how much risk mitigation is worth the price of shutting down churches for the holiest day of the Christian calendar and far beyond 2020? Do you see what I'm fucking talking about? Do you see what I mean? Oh my God. So literally, not that it was killing people, not that people were losing people at record paces, not that people were infighting between COVID is real and COVID is not between people who didn't want to wear masks, not between kids who didn't go to school, not between colleges who couldn't graduate. Oh, thank you for the head. Appreciate you. Thanks for joining the team, Patty. Not all of that. The first thing they fucking say was you couldn't go to church on the holiest days. You couldn't go to church on your holiest day. Okay, this wasn't just Christians this affected. Of course people wanted to go to any of their religious beliefs and they wanted to celebrate the way that they wanted to. However they wanted to. But you're saying, oh, Christians couldn't go to church on Christmas because we didn't have it under control. And you're like, yeah, but it's not just Christians that affected. Why didn't you just say groceries? Why didn't you say sporting events? Why didn't you say school, work? You chose to say the fucking holiest of holidays in the Christian calendar and far beyond into 2020? Question mark. How stupid. How ridiculous. What is the proper balance of lives saved versus souls saved? Oh, bitch. Anyway, that's a highlight. I think that is, I'm going to put that, that's going to be somewhere up in my office today. Where does it say? What is the proper balance of lives saved versus souls saved? What are you talking about? Are you talking about Jesus, God, my soul? There aren't people who believe in that. So you're saying Jesus, Lord, actual Christ. The CDC has no business making such inherently political and often unconstitutional. Okay, but it was assessments and should be required by law to stay in its lane. Yeah, you don't get to tell me that science tells me if I enter that church and people have bubonic plague that I'm going to die because it's the holiest day and I'm going to be there because I'm going to save my soul. Even though if I come in contact with anybody who has leprosy, I'm going to perish. But my soul will be saved because the CDC didn't intervene. Whoo, Lord. The CDC... I'm sorry. Just, what is the proper balance of life saved versus souls saved? Well, 1 million people died, and if we're believing, Christian statistics, at least 500,000 of those, their soul hopefully was saved. The CDC's initial COVID-19 testing failures were largely a result of that agency's prioritizing its own development and production of tests using its internal staff and facilities. Wrong. Trump admitted that they gave tests to Russia. So while you're out here blaming people, epidemiologists, the CDC, actual medical professionals, that you're out here blaming for this, you're out here just pussyfooting all the way around it. It's like, we didn't have the tests because they didn't have them. No, you shipped them across the sea. According to Sarah Palin, you just shipped them right across their neighborhood. You just shipped them in Russia. You're trying to blame the CDC when it was you, Donnie. You did this. Well, it's probably half those tests were in his shitter. That's just face facts. Along with the documents, probably some old tests. Why not at this point? The private sector is much better positioned to tackle the challenges inherent in developing and manufacturing novel products, as illustrated by the relative success of the alternate approach to facilitating the development of COVID-19 vaccines and therapeutics by private companies that was adopted by the FDA. When it comes to testing, the CDC's role should similarly be to facilitate rather than supplant the efforts of the private test developers, academic laboratories, state and public health laboratories, and the clinical testing providers. When responding to a novel pathogen, the CDC should focus on gathering and disseminating information, including specimens needed for development of positive controls and reference panels, and ensuring that test developers can develop and validate diagnostic tests. These changes will require a shift in priorities in the culture of the CDC and throughout HHS more broadly. Okay, so again, we're going to be putting RFK Jr. in this mix, right? Okay. What's he going to prioritize? Whatever he believes. Not what the science says, what he believes. Most problematically, the CDC presented itself as a kind of super doctor for the entire nation. Yeah, Halo with the heart side, love you. So the CDC it's a super doctor? No, it's super knowledge. It's the whole department. It's what they do. It's their job. For the entire nation, the CDC is a public health institution, not a medical institution. According to its mission statement, the agency focuses on disease prevention and control, environmental health and health promotions, and health education activities. How is that? The CDC is a public health institution, not a medical institution. Who deals with diseases? Medical institutions. Who deals with environmental health and health promotions for health education activities? Right there. Medical institutions. It is not qualified to offer and usually does not purport to offer professional medical opinions applicable to specific patients. Because every single time that you do, there is red tape. Every single time. From time to time, the CDC offer findings and recommendations that competent medical practitioners will often consider in arriving at a professional medical judgment for a particular patient. In this respect, CDC guidelines are guidelines for another private health association or medical societies. They are informative but not prescriptive. By statute or regulation, CDC guidelines must be prohibited from taking a prescriptive character. For example, never again should the CDC officials be allowed to say in their official capacity that school children should be masked or vaccinated through a schedule or otherwise, or prohibited from learning in a school building. You're trying to tell me. Nope, you can't tell my kid they can't be here because they're not wearing a mask. You can't tell my kid they can't be here because they're not vaccinated. Wrong. Get the fuck out. I'm not going to have you do these damn chicken pox parties where everybody gets sick. People are vaccinated. When you vaccinate yourself, it's not just for you. It's for others too. We eradicate diseases through vaccines. So can you space out your schedule of your vaccines? Of course you can. Of course you can. But there are some, like polio, measles, chicken pox. You probably don't want those ones. So you sending your kids off to school thinking it's Jesus in nature is ridiculous at its core. But to just be like, what the hell? Telling children were much more willing to mask up and be vaccinated because they understood that it's we, not me. But they're going to say children because it's going to tear at the heartstrings. Such decisions should be left to parents and medical providers. We have learned that the CDC says what people should do rarely becomes must, backed by severe punishments, including criminal penalties. CDC should report on the risks and effectiveness of all infectious diseases, mitigation measures dispassionately, and lead the should and must policy calls to politically accountable parties. So you want the CDC to get rid of should and must, but give it to a political person who has no medical training. Okay, you heard crickets too. They're maniacs. Oh, I'm sorry. I'm just kind of reading the bottom. They are maniacs. See this, and because I can see this, I can go back and read a couple more of my. I'm like, oh, I can see because when it's sub only, I can read through it because half the time it was just flooded and I can't see. Who are they are maniacs. They're absolutely maniacs. Conflict of interest. There was a time when the CDC could not take money from pharmaceutical industries, but in 1992, the agency discovered a loophole in the federal law that allowed it to accept pharma contributions through nonprofit CDC Foundation. The money started flowing immediately, and from 2014 through 2018, the CDC Foundation received $79.6 million from pharmaceutical corporations like Pfizer, Biogen, and Merck. This practice presented a stark conflict of interest that should be banned. You're right, and only give it to people. Oh, thank you for the cap. I appreciate you. I'm so sorry. Well, we love you. I love you guys for wanting to listen because I was not born tall. I was not born pretty. I was born petty and fucking loud. But I've also was born with an inherent knowledge of wanting to read to the masses. That's what I do. So it's conflict of interest because they couldn't benefit off it? Data systems. The COVID-19 pandemic has revealed disastrous public health consequences of the CDC's failure to follow multiple congressional mandates to modernize its data infrastructure. Half of you vote against the infrastructure, so and good luck on that, boo. Currently, reporting methods are burdensome for frontline medical workers, yet they result in only fragmented data that are not available in real time or usable across systems. Congress should require HHS to prioritize the electronic collection and dissemination of robust, privacy-protected data that better leverages existing systems while reducing burdens on clinicians. You don't care about clinicians. You don't care about medical staff. Shut up. HHS should also enter into public-private partnership with data management experts to develop a system that makes critical information available to healthcare workers and policy makers in real time. No. Healthcare workers, I agree with. Policy makers, absolutely fucking not. The CDC operates several programs related to the vaccine safety, including Vaccine Adverse Event Reporting System, the VAERS, Vaccine Safety Data Link, the VSD, and Clinical Immunization Safety Assessment, CISA project. Those functions and their associated funding should be transferred to the FDA, which is responsible for their post-market surveillance and evaluation of all of their drugs and biological products. Okay, so we're just going to take VAERS, VSD, and CIS and put in the FDA, which they want to dismantle. Good times. Respect for life and conscience. CDC should eliminate programs and projects that do not respect human life and conscience rights and that undermine family formation. Oh, okay. I see where this is going. Yep, exactly what I thought. Okay. It should ensure it is not promoting abortion as health care. See what I'm saying? So they want to split it up. And then it's a four-family formation. Remember, conception to natural death. And now they want the CDC to be like, you're not going to promote abortion as healthcare anyway. It should fund studies into the risks and complications of abortion and ensure that it corrects and does not promote misinformation regarding comparative health risks and psychological benefits of childbirth versus the health and psychological risk of intentionally taking a human life through abortion. Okay, so they want the CDC to play God. That's what they want it to do. Because right there, the psychological benefits of childbirth. Please explain to me how the psychological benefits of childbirth pertain to a 12-year-old who was raped. I'll wait. Nothing? Still nothing? Okay, but the health and psychological risks of intentionally taking another human life through abortion is somehow bad. 13-year-old gets raped. 13-year-old gets pregnant. Abortion is awful. It's terrifying. It's heartbreaking. But the psychological benefits of a 13-year-old who cannot vote for 5 more fucking years is somehow better to raise a child. They can't even get a job. They're not even in high school. But the psychological benefits outweigh the abortion devastation. How dumb. The CDC oversaw and funded the development and testing of COVID-19 vaccines with aborted fetal cell lines. I'm not even going to get into that. It's not insensitive to the conscience tens of thousands to hundreds of thousands of people who objected to taking a vaccine with such a link to abortion. It was not. Listen to me now. Point blank, it was not. That is a lie. If things were donated for science, there's a different story. But it wasn't like people were just like aborting babies, aborting fetuses, so that they could fucking jab you with COVID-19 vaccines. Shut up all the fucking way. As evidenced by litigation across the country, it is likely thousands were fired unjustly because of their exercise of conscience or faith with this question, which could have been avoided with a modicum of concern for the issue of the CDC. Nobody was like, I don't want the jab because it's aborted fetuses. No, they were saying it because they were being told by MAGA. And they're like, you're not going to give me the jab. I'm going to get a jab. Meanwhile, all these people bitching, I'm not going to get jabbed, probably had at least 10 to fucking 20 vaccines in their entire life at that point. Okay, so not this jab, but dip-tet. Okay, not this jab, but tetanus. I'm not taking the jab. I'm a pureblood. That's the dumbest shit I've ever heard. Go read a fucking textbook. Go understand what mRNA is. Go understand. In a global pandemic, you're going to be like, my body, my choice. Oh, no. Oh, okay, so now we see how it's going to play. You're not going to jab me. It's my body, my choice. Well, yeah, well, it's my uterus. It's my abortion to give stem cells so you can have that. How about that? There has never been justification for ending a child's life as part of research, and it never was. It never has been that way. Nobody has been like, I'm pregnant, let's get this fetus up so I can donate it for science. Never won. Never fucking won. Don't let them lie to you because it's bullshit. And the thing is for them is eventually this will all be taken offline, but guess what? I have it printed out. So I get to read over this for the next 4 years and be like, nope, you said this, what's this? And I'll keep making notes for this next 4 years every single fucking time. Nope, you said this. Nope, you said this. Research from splicing or growing aborted fetal cells and aborted body parts can easily be provided by alternate sources. Stem cells. The stem cells that congressmen vote against, there are congressmen out there who have benefited from stem cells. For me and not for thee is the whole shtick. The whole shtick. There's never been a justification. and all research should be prohibited as a matter of law and policy. CDC should update its public messaging about the unsurpassed effectiveness of modern fertility awareness-based methods, FABMs, and family planning, and stop publishing communications that conflate such methods as the long-eclipsed rhythm or calendar methods. The CDC should fund studies exploring the evidence-based methods used in cutting-edge fertility awareness. So they're not going to tell you about ways to prevent pregnancy. They're going to ramp it up. Thanks for joining the team, Grammy. They're going to ramp it up so that you have the capacity to be like, oh, cutting edge fertility. What if I don't want to have a child? What if I'm done having children? What if I can't have children? But by all means, don't tell me how to prevent pregnancy when I don't want it, because birth control is going to go away. Sorry if you take birth control for other methods. It's going to be gone. Data collection. The CDC's abortion surveillance and maternity mortality reporting systems are woefully inadequate, meaning they're not telling you what they don't want you to tell you because it's a woman's right, or a person with a uterus's right. That's what they're saying. Nope, we're not giving that information. They're like, oh, it's horribly inadequate. CDC abortion data are reported by states on a voluntary basis, and California, Maryland, New Hampshire do not submit abortion data at all. Exactly, because it's none of your fucking business. Accurate and reliable statistical data about abortion survivors, and abortion-related maternal deaths are essentially to timely, reliable public health and political and policy analysis. Fuck you all the way. You were trying to tell me because you can't get access if I had an abortion. First of all, I never have. And I hope that I never would have had to have had. But I don't really have to worry about that too much anymore. However, there are people that will and will need that. And what you're saying is you're pissed that you're not getting the data from state to state to state to state so that you can cross-reference women to see if they've had abortions. But guess what? You don't have that option. The CDC's like, no, if we don't have to provide it, we're not going to provide it. And you're trying to do it under the guise of abortion survivors. Do you mean a woman had a fetus aborted? That would be the survivor. There's the psychological issue right there, right? She should need the help and she should get the services she needs so that she can go back to her regular life. Right? Right? Because liberal states have now become sanctuaries for abortion tourism, HHS should be available everywhere in a tool including cutting of funds to ensure that every state reports how many abortions take place within its borders. Control. Right there. Page 45. 455. Right there. Right there. Where it should report exactly how many abortions take place within its borders and the gestational age of the child, for what reason, the mother's state of residency, and by what method. So they want to know how far along you were, where you came from, why you had the abortion, and are you going back? They're trying to keep tabs on your fucking menstrual health. They're trying to keep tabs on if you had an abortion and why. Why? Because no fault divorce. If my wife goes across state lines and has an abortion and doesn't tell me, and now I have the data for that, well, guess what, pals? He's probably gonna beat the shit out of her. You know what I'm saying? It's like, really? You want to get rid of it? Cool. And I'll say it again. To ensure every state reports how many abortions take place within its borders, at what was the gestational age of the fetus. Stop saying child. Stop saying child. It's a fetus. And for what reason, and the mother's state of residency, and by what method. Control women. That's what it's about. It should also ensure that statistics are separated by category. Spontaneous miscarriage, treatments that incidentally result in the death of a child, such as chemotherapy, stillbirths, and induced abortion. In addition, the CDC should require monitoring and reporting for complications due to abortion in every instance of a child being born alive after an abortion. If you abort a child after it's alive, that's called fucking murder. But Keep them young, keep them dumb, keep them uneducated. Unfortunately for you, I like to keep people educated. Thank you for joining the team, Sherry. I appreciate you. I like to keep people educated. Moreover, abortion should clearly be defined as only those procedures that are intentionally end an unborn child's fetus's life. Miscarriage management or standard ectopic pregnancy treatments should never be conflated with abortion. And how do you get miscarriages and ectopic pregnancies taken care of? Abortion! This is why men shouldn't write these manuals. Comparisons between live births and abortion should be tracked across various demographic indications to assess whether certain populations are targeted by abortion providers and whether better prenatal physical, mental, and social care improves infant outcomes and decrease abortion rates, especially among those who are the most vulnerable. You want to keep tabs on everybody from the poorest of the poor on all the way up to the people. Oh, the richy riches, they're not going to have to. No. Mistresses will still be able to get abortions. That's not going to be a thing. No, what we're talking about here is, why did you have this? Did you leave your husband? Why are you having an abortion? Oh, it was incest? Oh, well, don't worry, because most of the time under new laws, it shows that those who offend the crime, who cause SA, those who cause rape, will usually do less than a woman who has an abortion because the felonies are a little bit different. So women are going to be criminalized all over again. Why not? The Ensuring Accurate and Complete Abortion Data Reporting of 2023 would amend Title 19 of the Social Security Act and Public Health Service Act to improve the CDC's abortion reporting mechanisms by requiring states as condition of federal Medicaid payments and family planning services to report streamlined variables in a timely manner. Oh, but Medicaid, I thought you want to get rid of Medicaid. The CDC should immediately end its collection of data on gender ID. This is the last part. The CDC should immediately end its collection of data on gender identity, which legitimizes the unscientific notion that men can become women and vice versa, and encourages the phenomenon of ever-multiplying subjective identities. Let me explain something to you right now. If you've ever met a trans man, sometimes they still have uteruses. Sometimes they still have vaginas. So for you to take and end your collection on gender identity, which legitimizes unscientific notion, you are saying that persons with uteruses should not be counted because technically they shouldn't exist, because that's a woke ideology. And just because you're a trans man and somehow you get raped and you get pregnant, you're not even included in that statistic. So where exactly do you fall? When trans men get sexually assaulted and raped and become pregnant, where do they fall? What category do they fall? Are you not going to recognize them? Are you not going to provide them care? Are you going to provide them immediate abortions? Are you going to just put it under the rug? Where do trans men who get pregnant fall? What happens to them? Some things that you're not thinking about real fucking clearly. Food and Drug Administration. Let me see how many are this. I'll probably do a couple more pages today, and then I'll try to pick up tomorrow. Same kind of thing. So, the Food and Drug Administration, the FDA. The FDA's mission includes ensuring the safety and efficacy of drugs, biological products, and medical devices. The FDA, federal laws that shield big pharma from competition. Because generics generally cost far less than brand name drugs, no shit, consumers begin to save money as soon as the generic product becomes available on the market. The vast majority are very affordable, with 93% of generic products costing $20 or less. And the reason those generics cost less is because they usually had brand names, and after their patent wears off, they're able to provide it at generics, which should always be the case. But there are people within both categories that it doesn't pertain to them because the actual brand name is not the same to them in their bodies. Biologically, it's a fact. So some people have to have generics only, some people have to have brand name only. Savings would be even higher under the proposal that prevented brand name manufacturers from slowing down or impeding the entrance of generic production into the marketplace. Specifically, the FDA should prohibit pharmaceutical companies from purposely sitting on their legally available right to sell the first generic versions of these drugs. Additionally, Congress should create legal remedies for generic companies to obtain samples of brand name products for their generic development and efforts, and should prohibit meritless citizen petitions submitted by manufacturers to delay approval of generic competitors. They do and don't mean that, because Big Pharma pays big money to have brand names, and they have those patents for a reason, because they roll them out as they deem fit after their patent expires, or they give certain preference to certain companies. They're not going to give that up. So them just saying that's actually just a bunch of bullshit in there. Approval processes for laboratory developed or modified medical tests. Learning from failed early COVID-19 testing experience, Congress and the FDA should focus on reforming laws and regulations governing medical tests, especially with respect to laboratory-driven tests. Commercial tests are developed with the intention of being widely marketed, distributed, and used, while laboratory-developed tests are created with the intention, in accordance with the protocols developed on another lab. Non-commercial sharing currently constitutes a new laboratory development test because the lab in which it was used is different from the initial developing lab. Also, I should mention this a lot of the times in this manifesto as well. Thank you for that. I appreciate you, one. They're run-on sentences, so sometimes my brain hurts a little bit. To encourage interlaboratory collaborations and discourage duplicative test creation and associated regulatory and logistical burdens, the FDA should introduce mechanisms through which laboratory-developed tests can be shared with other laboratories without the current regulatory burdens. Okay, so less testing, and they want to just go through all the way through HIPAA. Okay, great. Next. Okay, I'm going to read another page and a half, and then we're going to be done for today, and we'll start again because I want to read the rest of this chapter before I go back to the other ones. How much is in this chapter? This chapter is quite a bit. This is going to take a couple of days. I know that's going to take a couple of days, and that's okay. Because this is the stuff that really pertains to everybody and what should be readily available. Like, here she goes. Okay. Laboratory developed test category currently encompasses a range of possible tests, many of which would be characterized more appropriately as laboratory modified tests, because they are not truly novel tests, but rather modified versions of existing tests. To avoid stifling innovation and access medical care, and applicable statutes and regulations should be revised to facilitate greater access to such modified tests. They want to pay less. They want to pay less. Thank you, Halo. Woohoo! Cheer up for me. Finally, the long held that its regulatory authority over such tests, the FDA, while others have argued should be considered clinical services regulated by the Center for Medicaid and Medicare Services, CMS. The FDA currently has regulatory authority over in vitro diagnostics under Clinical Laboratory Improvement Amendments, the CLIA, and CMS ensures that labs meet analytical validity standards for test methods. Congress, the FDA, and CMS need to clarify and disentangle overlapping authorities over tests to eliminate regulatory confusion. Less testing. Drug shortages. The very thin profit margins on the regulatory burdens associated with generic manufacturing discourage inventory and capacity investments by manufacturers and contribute to drug shortages. HHS and FDA should encourage more dependable generic drug manufacturing. The FDA should expand its current pass-fail approach to drug facility inspections into graded systems that recognize manufacturers that exceed minimum standards by investing in improving production reliability. The FDA should also add facility codes to drug packing and construct a searchable database that cross-references product codes and facility codes. That would enable wholesalers and pharmacy benefit managers to identify and preference drug manufacturers at the more reliable facilities, thus encouraging generic drug manufacturing to compete on reliability as well as price. For its part, HHS should accept multi-source generic drugs from requirements to pay rebates to Medicaid and Medicare and other federally funded health programs to those provisions penalize new investments and expand in manufacturing capacity when supply is unable to meet demand. Additionally, the FDA and the NIH should promote efficacy trials of new applications of generic drugs, which might include NIH funding such as trials or conducting its own. The last part we're going to talk on is abortion pills. It's right there, page 457. So when I read today, guys, it's going to be 449 through 458. And like I said, I will upload that later on. Abortion pills. Abortion pills are the single greatest threat to unborn children in post-Roe world. No, they are available for women and people with uteruses to have a medication to not cause children, not cause fetuses, not cause fertilization. You know what I mean? The rate of chemical abortions in the U.S. has increased by more than 150% in the past decade. More than half of annual abortions in the U.S. are chemical rather than surgical. Thank the Lord. The abortion pill regimen is typically a two-part process. The first pill, mifepristone, causes the death of the unborn child by cutting off the hormone progesterone, which is required to sustain pregnancy. So it's not really killing anything. It's taking away the progesterone, which would encourage a healthy pregnancy should it want to come to fruition. And mifepristone is not just used it's not an abortifacient specifically. Rheumatoid arthritis, pediatric cancers use mifepristone, which is required to sustain pregnancy. The second pill, misoprostol, causes a contraction to induce delivery of the dead child and the uterine contents, usually in a toilet at home. So, what we're saying is there's two medications. One goes in and it stops the hormone, so it stops creating and dissecting of cells, multiplying of cells, and then it has a period for you. That's what they're referring to. The abortion pill regimen is currently approved for up to 70 days, 10 weeks into pregnancy, and before Biden was subject to the heightened safety restriction called Risk Evaluation Mitigation Strategy, or REMS, that requires an in-person visit with a physician who can check for dangerous contraindications such as ectopic pregnancies and can advise mothers seeking an abortion of the risks of chemical abortion, including hemorrhaging, and what to do in such circumstances. Chemical abortions have been found to have a complication rate 4 times higher than that of surgical abortions. Okay, so why are you not giving both? Just because it should be both. Since its approval more than 20 years ago, mifepristone has been associated with 26 deaths of pregnant mothers. 26. 26 deaths in 20 years. So a little over 1 a year. It's pretty effective in other medications and regimens, such as Crohn's and whatnot as well. Anti-inflammatory, MS. And doctors are scared to prescribe it because it's technically an abortifacient. But patients who need that medication aren't able to get it because apparently over a 20-year course study, 26 women have died. And while that's tragic, that is a very low number. Over 1,000 hospitalizations and 1,000 more adverse events. That number does not account for all complications. If you've ever seen there's a TikTok out there, and I've got to find it. Basically, it's like 1,000 ways a woman could die from conception to birth. So, yeah, a woman can die, and somehow that's okay. But the fetus, protect that shit until it's out, and then yeet that motherfucker because we're not paying for a damn thing. Of course, this does not count the hundreds of thousands of millions of babies whose lives have been unjustly taken through chemical abortions. This is the last thing we're going to talk about. The FDA, therefore, should reverse its approval of chemical abortion drugs because the politicized approval process was illegal from the start. It was. The FDA failed to abide by its legal obligation to protect the health and safety and welfare of girls and women. That's exactly what that does. It never cited the safety of the drugs under the label conditions of use, ignored the potential impacts of hormone-blocking regimen in developing bodies of adolescent girls, disregarded the substantial evidence of chemical abortions caused more complications than surgical, and eliminated necessary safeguards for pregnant girls and women who undergo the dangerous drugs and regimen. Pregnant girls. They are saying pregnant girls, not women. Pregnant girls, page 458, right in the middle. They are saying right there, the bodies of adolescent girls, girls who probably should not be having children because they're not old enough to make that decision. But be damned, right? Because Nick Fuentes, your body, my choice, I told you, is going to turn into your dick, my knife. It's going to happen. Furthermore, at this point, past 2 decades, the FDA has never acknowledged or addressed federal laws that prohibit the distribution of abortion drugs by postal mail. To the contrary, the FDA has permitted and actively encouraged such activity. Now that the Supreme Court has acknowledged the Constitution contains no right to an abortion, and it doesn't say it in the Bible either, so, I mean, whatever. We're just talking out of our ass. The FDA is ethically and legally obligated to revisit with withdrawal of its initial approval, which was premised on pregnancy being illness and abortion being therapeutically effective at treating this illness. The FDA is statutorily charged with guaranteeing the safety and efficacy of drugs and therefore should withdraw the drugs that have proven to be dangerous to women by the definition of fatally unsafe for unborn children. As an interim step, the FDA should immediately restore REMS by removing the in-person dispensing requirement to eliminate dangerous teleabortions and abortions by mail distributions. Mail order abortions. Allowing mail order abortions is a gift to the abortion industry that allows it to expand far beyond brick and mortar clinics and into pro-life states that are trying to protect women, girls, and unborn children from the abortion. So we're going to stop there, actually. It's the top of page 459. So they're mad that you can have access to drugs to chemically have an abortion at usually under 10 weeks. Because most women don't even know they're pregnant at 6 weeks. Because that's not how that works. And then they want to get rivet through mail. And doctors who prescribe that for patients who do not use that for that are going to be scrutinized. They can lose their license and go to jail. They'll be like, this was for treatment for something else. They're like, yeah, but it's an abortifacient. So they're going to try to get it through the Comstock law. So what the Comstock law says, and it was of 1873, give or take, I apologize. The Comstock law says that you basically, and that's what this is going to talk about too, in the Comstock law, you can't mail obscene things in the mail, including abortion pills. They consider that obscene. So, guys, I will upload this tonight. Well, again, it'll be 449 to page 459. That's actually, it was only 10 pages, and I apologize, but we're getting back into this because, again, we're going to have to go back and forth a little bit to see what we're going to do. But I want to try to do this 2 or 3 times a week and as many times as I can, and just to get information out there. And again, if you can't listen, I will upload it. It'll be on my YouTube later. I'm only going to keep these lives as sub only for comments, just to keep all the rhetoric and bullshit down. You can also download it if you want to on Project 2025. You can do that. I know now they're asking for your email address, like they're tracking you. And I was like, D's nuts, bitch. That's my email address, D's nuts, biatch, because I already have it. So if you have a question, if you have anything that you want, you can always feel free to ask in here. I'm going to go through as much as I can. It's a lot to get through, but I refuse to give up. I refuse to lay down. I refuse to let them win. And I will give everybody as much knowledge and power as I possibly can, because I think it's really important. I think it's important to stay focused. I think that the election outcome is the election outcome. And as much as I have all of my own opinions on that, there's not really a whole lot we can do other than just let it happen. And I'm going to tell you right now, if you have people in your family that are Trumpers, it's okay to be like, fuck off. Nope, we're done. This is no longer we're really going to let politics divide us? Yes, because it's a morality issue. You're hurting other people that I love, other people that I care about for the sake of you, for your Christianity, for your whiteness. You know, and I can say that because I'm fucking white, but I can yell at my other fucking fellow white people. There's a difference. There are white folks and there are white people. I'm white folk. And yes, I have worn the blue bracelets, and yes, I have put the blue underneath my eye. But this next 4 years is going to be a bunch of people who came to the Hill. Black voters, black females, black males, Latinos, mothers, grandmothers, all of them who came to the table. And look what happened. I personally, the results are a little sketchy to me. Like, something seems amiss, but what am I going to do? I could spend the next 4 years being conspiracy theorist, or I can just get to fucking work. I can get to fucking work, and I'd rather be to fucking work. I'd rather get this out to people who have no idea what this is. And if you want to, we can talk about other topics too. They come up like, yeah, I don't really understand this. I mean, we can go directly into Project 2025. We can talk about like what a fucking tariff is. So real quick, if you do not know what a tariff is a fee that is imposed on the American company that takes that imports that iPhone that comes from China that is $500, right? And now there's a tariff going to be put on that. The tariff, say like the tariff is $100. You really think they're going to sell that same phone to you for the same rate? No, they're going to increase that. Tariffs are not paid by other countries. They are paid by the companies here that import the good. And when you have that good and you pass that good along to somebody because you've had to pay the tariff out of your own goodness in your heart, you're not going to just let up and be like, oh, no, we're going to keep the same price. No, the fuck you can't. You can't go out. You can't go. That's not going to be good for business. So small businesses, they're going to suffer. Bigger businesses who have to get product are going to suffer. You're going to see a lot of different suffering when tariffs come in. You're going to see supply chain get real fucked up. You're going to see, I'm already starting to see it. People are ordering product getting ahead of next year and are having to lay off people because they have to have raw material. Small businesses are going to die out. There's going to be many different things that are going to happen because of these tariffs. So we can talk about Project 2025 and we're going to talk about everything about that. But we're also going to talk about what this next couple of years is going to look like, because buckle up. If you thought it was a dumpster fire before, we are going right back into PTSDville, because that's the fuck we are. But I appreciate you guys staying with me now. Make sure you set your notifications, and I will see you. I might see you tomorrow, but definitely if not, I will see you Thursday at 11. Okay? Take care of yourself, guys. I love you.